Welcome to the Kachmann Wellness Talk. Thank you for looking at some of the others I've done. If you haven't, look at those, because you'll become very educated from these sort of 10-minute little talks, mainly on health and having some fun, and maybe even tap dancing, whatever it might be. But today's subject is to get some proper blood testing early in your life. And just looking at a person and being of normal figure, normal weight, for example, I always tell people, you're not just what you look like. You know, some people look thin, normal figure, and they're the trophies, taller on the outside, but thin on the outside, fat on the inside. So blood testing is very critical. Get yearly blood testing starting as a child. Check your teenagers, for example. And I like to keep it cheap and very simple. For example, how you use your sugar is measured sometimes by hemoglobin A1C, okay? That's sugar and protein combined, and that's, if you run that test, that tells you what's been going on with your sugar in the blood for the last 3 months. But it catches you late towards diabetes, so I like you get a little earlier, and that way would be to get a glucose tolerance test where you swallow 75 grams of sugar after not eating overnight, and then in the morning they pull a fasting blood sugar and a serum insulin, and then they can repeat it in 1 hour, 2 hour. 2 hours is probably enough. If 2 hours after you ate that sugar, okay, and your blood sugar is over 200, you're probably diabetic. Yeah, in 2 hours, normally blood sugars return to normal after you've have eaten, and the serum insulin would be elevated. Now, if you didn't want to pull serum insulins, they don't cost really that much, but people think they're expensive. So just 2 hour blood sugar over 200, you are indeed diabetic. If you do yearly testing like that, you will catch type 2 diabetes, which causes about 70 illnesses, okay? To avoid all those, if you run these tests, if then we're to lose 5 to 8 pounds of weight, you'd be healthy. Wow. That's really great news. So I really insist that you do that, and don't let your doctor say, well, you know, last year your tests were normal, we don't need to do it this year. No, you do it every year, and you enter in the computer, or maybe keep it in a book, and you watch the path of your blood sugars over time. Maybe you watch the path of the fats in your blood, the triglyceride being the most important. The reason for the triglyceride is, well, our 70 trillion cells in our body have on them receptors like this, and sugar gets converted to triglycerides, a fat, and make these receptors sticky, and insulin cannot get the sugar in the cell for energy, okay? And that's the reason the blood sugar eventually goes up, but the serum insulin goes up before the blood sugar. That's the reason I say the serum insulin. I totally insist that you get those tests, and because it'll keep you healthy, add 30 years to your life, disability-free life, versus type 2 diabetes, amputations, dementia, heart attacks, strokes, a lot of them unannounced, all can be avoided, increased rates of cancer. So I like this yearly blood testing is being critical. And if you feel like, hey, I don't have insurance, so I can't afford it, get that 2-hour glucose tolerance test with a serum insulin and a blood sugar. Cost you maybe $50 at most, and you'll know where your life is heading, and then you can do something about it and live to be 100. That's my goal. That's the name of my website. Facebook, Kachmann, Live to Be 100. I want to be standing there as we both do it together. Okay. Thanks for watching my post. We'll do another one next week. God bless. We love you.